So there is a erythroplakia. Whenever we come into the definition, it is a fiery red patch that cannot be characterized clinically or pathologically as any other definable lesion. It's a kind of free malignant lesion just before of malignancy, like oral cancer or squamous cell carcinoma. So why it's abnormal or abnormally red? Actually, it is a blood vessel enlargement seen in that conditions. Presence of blood in the tissue, increased hemoconcentration. The hemoconcentration, when we going into hemoconcentration meaning, it was like rapid decrease in the blood plasma level and blood components. So it's called hemoconcentration, and it's happened in these erythroplakia. And also reduction in the number of epithelium cell, increased vascularization, and of course the presence of blood in the tissue. Whenever it's come to site and prevalence, in male, its ratio is similar to male and female, but when it comes to female, then gingiva is the most common site, very common site in gingiva. Buccal mucosa is the second most common. Retromolar area, tongue, soft palate, floor of the mouth. But when it's come to in the floor of the mouth, so it's like it's very dangerous. So it's in very dangerous way, you say, it's present in the floor of the mouth, erythroplakia. And alveolar ridge, it's also most common in the female. So gingiva and alveolar ridge are most common site present in a female. Why it's happened? That's the main thing now. Why it's occur? So it's like there are many reasons of getting erythroplakia, like inflammatory, any kind of inflammation, any kind of vascularization, and autoimmune vesicobullous region, and infections. So there are several kind of infection that caused erythroplakia. And neoplasm, of course, neoplasm, the malignant transform of the tumor or the malignant tumor. Example, cancer. So, like clinically, how it's you identified it. First of all, there is something where you confirm that it is a erythroplakia. Like biopsy is the thing, the goal. Like, okay, it's a biopsy. But there are kind of thing that confirm there is a erythroplakia. Cytoluidin blue, Lugol's iodine, chemiluminescence, KOH, exfoliative cytology. And when it's seeing clinically, there is a red wall demarcated path with no sign of infection or inflammation. Okay, so what was that etiology? So when it's come to etiology, it's like tobacco habit patient. Most patients coming with the erythroplakia have tobacco habits like chewing tobaccos and smoking tobaccos and some kind of infections like candida infection. Candida infection is very common nowadays. Alcohol and some idiopathic, no reason, but it's occur. Sometime when it's come to differential diagnosis mean the another disease have same something like this or same symptoms like this, then you say it's a differentiate differentiate with 2 disease, 3 disease, 4 disease, something like it, like pemphigoid, pemphigus, candidiasis, oral vesicobullous region, lifus erythematosus. There is a thing, you said it. So yeah.